I was diagnosed at age 14. At that time, it was very, very scary because I was totally inexperienced. I was in grade 9. Now I'm 21. My name is Laura. I have brain cancer. I'm a person, not just a patient.
My name is Julie. I've been living with advanced cancer. I'm not just a patient. I am a person. Well, I was born and raised in Rouyn-Noranda. Came to Montreal when I was 17 to study in police technology. That became my profession. I became a police officer, and I've been working as a police officer for the last 17 years. In late 2012, I was diagnosed stage 4 breast cancer. We thought initially that I was a stage 2, and then with all the scans and everything, we found out it was a stage 4. Quand on parle de cancer, il y a beaucoup d'isolation reliée au cancer. Le jour, travail, fait que tu te ramasses toute seule. C'est difficile de gérer cancer, l'isolation. Le monde de notre âge travaille, vont à l'école. Des fois, le soir aussi, c'est difficile. Tout le monde, il faut qu'ils lavent, il faut qu'ils fassent de la nourriture. Fait qu'ils n'ont pas le temps de venir te voir, ils n'ont pas le temps de... Les fins de semaine, ils ont juste 2 petits jours, fait qu'ils essaient de profiter. Il y en a beaucoup qui ont des enfants. Si toi, tu as des enfants, mais il faut que tu t'occupes de faire la nourriture, puis des fois, tu te sens comme de la merde. Heureusement, ça n'a pas été mon histoire, mais j'ai beaucoup d'amis qui ont des enfants, puis que c'est ça. Puis là, essayer d'incorporer des choses saines dans ta vie, pas juste la nourriture, mais juste la façon de fonctionner dans la vie, c'est pas évident parce que c'est des changements. Puis quand on est toute seule à vivre le changement, puis personne d'autre embarque avec nous, c'est encore plus difficile parce que tu te sens en plus toute seule. Fait que tu sais, c'est vraiment... c'est difficile. C'est vraiment difficile.
I make jewelry, I keep myself busy. I have a lot of friends. I met a lot of new people through the cancer community. That's really what's gotten me through this. I met so many different friends. I met my best friend actually through one of the organizations, and it makes such a difference.
Like through treatment and everything, still do sports. I was a sports girl, always. I've always loved sports. There's a lot of places for us young adults come together, and I learned how to snowboard, and I learned how to surf, and I learned how to rock climb. I rafted down the Grand Canyon.
For me, it's important for my doctors and nurses and other medical teams just to know that I'm a person and that I'm not just a number on a piece of paper. I had a doctor that once told me to choose any type of chemo that I wanted because I'm going to be doing them all anyways. I didn't feel like a person then. The cancer community has made such a difference in my life. It's just a really big deal. And I'd like people to know that the support makes a very big difference.
Le futur pour moi, premièrement, c'est une journée à la fois. C'est ce que je prône pour les autres aussi. Peu importe que tu sois malade ou non, il faut apprécier une journée à la fois. Des petites choses comme boire un verre d'eau, puis l'apprécier, tu sais. Avec la vie qu'on vit maintenant, là, tout est vite. Puis c'est juste d'apprécier les petits moments, tu sais. Hey, je me suis assis 5 minutes, c'est pas grave, mais on peut l'apprécier. C'est facile à dire, mais c'est pas facile à faire. I think the most important thing is to remember that the person you're dealing with is a person. And that's easy to forget. Because of the role you are, you know, there's certain things that you have to respect with your role. And I totally understand that. But it's easy to forget that you're dealing with people, but you are. And that's the one important thing that you have to remember, knowing that the person you're dealing with, the patient, is a person, you know? Not forgetting that, not just getting lost in your role. Having them implicated in the decision or having their opinion is something that the patient appreciates, you know, because it is their life. Being included is being empowered, and Giving empowerment to the patient is important because they have to deal with it every day. Chemo, radiation, taking medicines at home, everything's hard, and things that you used to be able to do, you can't do anymore. And to have to deal with all that, empowerment at least is a little something,
It's not a simple thing, but they just have to try and understand on a deeper level and try to be more personal with the patient, because I'm not just that number on the paper, and nor is anyone else, and doctors shouldn't treat us like that. It's not fair and it doesn't make sense.